The heart's rhythm, understanding heart rate and blood pressure.
First, we need to know that our blood takes a round-trip journey through the heart. It comes in one way, gets a refresh, and then heads back out. See this right side of the heart? Blood enters the heart through two big veins. Think of them like highways. First, there is the superior vena cava, bringing blood down from the head and arms, and then the inferior vena cava, bringing blood up from the rest of the body. This blood is a bit tired, low in oxygen. We call it deoxygenated blood. It flows into the first chamber, the right atrium. Think of the atrium like a waiting room. The blood hangs out there for a bit. Then when it's time, it passes through a one-way door called the tricuspid valve. This door makes sure the blood only flows in one direction. Now, it's in the right ventricle, the pumping chamber. This powerful chamber squeezes and pushes the blood out through another big tube called the pulmonary artery, where it's going to the lungs for a little oxygen boost. In the lungs, the blood picks up oxygen and dumps off carbon dioxide, kind of like sweeping out an old air filter. Now, refreshed and oxygenated, it travels back to the heart through the pulmonary veins. See this left side of the heart? The oxygen-rich blood enters the left atrium, another waiting room. Then it flows through another one-way door, the mitral valve, into the left ventricle. This is the strongest pumping chamber in the heart. It gives the blood a big push and through the aorta, the largest artery in the body. From the aorta, the oxygenated blood travels all throughout your body, delivering oxygen to your organs, muscles, and every little cell that needs it. And then the journey starts all over again.
First, find a quiet spot where you can relax. Take your index and middle fingers and place them gently on your wrist, just below your thumb. You should feel a pulse. Count the number of beats in 15 seconds and then multiply it by 4 to get your beats per minute, also known as BPM. You'll need a blood pressure cuff. Wrap the cuff around your upper arm, making sure it's snug but not too tight. Pump up the cuff until the pressure is higher than your systolic pressure. Slowly release the air, listening for the sound of your pulse. The pressure at which first hear the pulse is your systolic pressure. Continue to release the air, listening for the sound to disappear. This is your diastolic pressure. Normal blood pressure is typically below 120/80. High blood pressure or hypertension can increase your risk of heart disease, stroke, and other health problems. High blood pressure or hypertension can increase your risk of heart disease, stroke, and other health problems. Systolic pressure. This is the pressure in your arteries when your heart beats. It's the top number in a blood pressure reading. Diastolic pressure. This is the pressure in your arteries when your heart rests between beats. It's the bottom number in a blood pressure reading.
First, we'll start with the front view of the heart. You'll see a big muscular organ with a few major blood vessels attached. The biggest one is the aorta, which carries oxygen-rich blood from the heart to the rest of your body. You also see the pulmonary artery and the pulmonary veins, which connect the heart to the lungs for gas exchange. Now, let's flip the heart over to the back view. Here you'll see the inferior vena cava and superior vena cava. These big veins bring the oxygenated blood back to the heart from the body. Let's trace a path of blood through the heart. The oxygenated blood low in oxygen enters the heart through the superior and inferior vena cava. It flows into the right atrium. From the right atrium, it passes through the tricuspid valve into the right ventricle. The right ventricle pumps the oxygenated blood to the lungs through the pulmonary artery. In the lungs, the blood picks up oxygen and releases carbon dioxide. The oxygenated blood returns to the heart through the pulmonary veins and enters the left atrium. From the left atrium, it passes through the mitral valve into the left ventricle. The left ventricle, the strongest chamber, pumps the oxygenated blood out of the heart to the aorta, where it is distributed to the rest of the body.
Imagine your heart is a house with 2 floors. Each floor has a room, an atrium, where blood collects before moving to the next room, a ventricle. Normally, these rooms are separated by a wall called the septum. However, in some people, there's a hole in this wall, and that's what we call an atrial septal defect, or ASD. This hole allows blood to leak between the 2 atria. This means that the oxygen-rich blood from the left side of the heart can mix with the oxygen-poor blood from the right side. This mixing can cause problems like making it harder for your body to get enough oxygen.
What happens if deoxygenated blood mixes with oxygenated blood in your heart? The answer: the overall oxygen level in the blood decreases, which leads to the heart to work harder.